Welcome to Smart Best Practices for Army National Guard ARNG E-Case Management. My name is Lorene Hall. I'm an MSN student at the Excelsior College of Nursing. I'm also a prior Army National Guard soldier and currently am the National Army National Guard Case Management Program Manager for Cherokee Nation Healthcare Services. The Smart Best Practices for Army National Guard E-Case Management Project was designed and implemented as an online and on-site professional development training for ARNG case managers in 10 states across the U.S. to utilize evidence-based best practices that synthesize the active Army and the CMSA standards of practice into standardized practices and processes within the Army National Guard state programs contracted by us. The United States Army National Guard currently has about 343,500 soldiers across the nation that are organized under a dual mission of federal service that comes under the purview of the President of the United States and state service, which is under the direction of each state governor. Most people do not realize that the National Guard has this dual active and state mission that they have to follow. In 2005, to put it in perspective, half of the Army combat brigades in Iraq were Army National Guard soldiers. Yet the Army National Guard also serves as a homeland first responder of sorts to natural disasters and defense against other threats within our shores and our nation. An example of this would be in the wake of Hurricanes Katrina and Rita. Over 50,000 Army and Air National Guardsmen were called onto state active duty to serve and protect here on our homeland, while simultaneously another 80,000 soldiers were serving on federal active duty around the world. These numbers are important because of the IMR, the individual medical readiness. How many soldiers are ready to mobilize and deploy? In 2005, IMR percentages for the National Guard was right around 18%, with the active Army being about 42%. Active Army put in case management into their programs, so by 2009, they were up to about 75%, whereas the IMR for the National Guard was about 30%. These percentage differences led the NGB to mandate in 2009 for all Army National Guard states to have contracted case management programs. And they worked. In 2014, IMR percentages were about 85%, which for the National Guard, which was awesome. But currently, there is no standardized employee training or national standards of practice for e-case management within the Army National Guard programs. Every program, every state has their own program, their own processes, and their own way of doing things, that are within the Army regulations, but not utilizing the current best practices for the e-case management. This means that in 2014, since 2014, that 85% has only grown about 2% in the U.S. Our stakeholders in this process are the Army National Guard soldiers who deserve and require safe, effective, quality, patient-centered care that can give them the best results and the best outcomes. Our Army National Guard military state commands have an increased individual and medical readiness of numbers of soldiers ready for deployment. Our company, CNHS, has an ethical responsibility to provide quality services. Our employees benefit through increased professionalism, knowledge, and job satisfaction. And the U.S. taxpayers, hey, they get a cost savings for the healthcare savings that case management can provide, as well as for not losing soldiers that fall through the cracks and have to be replaced. This project was developed utilizing an eclectic combination of principles from several theories, such as the adult learning theory, Watson's caring theory, and Carl Rogers' person-centered theory. Aspects of all these theories were incorporated into the training to create an environment that encouraged active student participation as well as increased connectedness to and acceptance of the education. The decision to incorporate these theories in this training was made to promote the inclusion of current evidence-based educational practices into the current evidence-based nursing practices. The main theory that provided the foundation within this project was the use of the adult learning theory. In the adult learning theory, educator needs to understand and remember 6 principles about adult learners. These students need to understand how and why this learning is needed, their self-awareness, their prior experiences with learning, their readiness to learn, the relevancy of the materials to them, and the motivation that they have to learn the materials. Adult learning is also student-centered, self-driven, and experiential in nature, which allows for autonomy and self-direction with the learning. As case managers and seasoned professional nurses and social workers, these employees bring a lot of experience and knowledge that enhances the training and allows them to accept and utilize it more effectively. The utilization of adult learning principles for educating the professional nurses and social workers involved in this training allows for greater participation and motivation to receive and learn the information. Embracing the different experiences and backgrounds within the training that the case managers already possess from their experiences provides the opportunity for these nurses and social workers to learn and collaborate with each other. When evidence is supportive of a position, it lends credibility and reliability to the topic. Failure to utilize best practices can lead to errors, miscommunications, missed opportunities, and misinformation. Utilizing civilian case management has been proven through evidence to increase patient outcomes and decrease costs. And identifying and utilizing best practices that follow those civilian case management standards of practice that are evidence-based could increase our ARNG IMR percentages within the states, as well as improve the outcomes for the soldiers who are injured or sick. The first strategy that was used to start this process of making changes was to employ transformational leadership and change leadership principles in my personal management style. Transformational leaders are dynamic and motivate their employees through a genuine concern for their personal and professional growth and empowerment. This style of leadership fit well with my belief in connecting with employees through caring practices like those espoused by Dr. Watson and the caring theories. Incorporating caring practices into nursing leadership increases positivity, motivation, and brings healing into the workplace environment. Change leadership involves motivating the employees to have the same vision as the leadership in order to have buy-in to the success of the change. I felt that the utilization of both of these principles with my employees as well as with the other stakeholders would give me the best results for this project. The second strategy I used was to bring about the needed training and guidance within our program, was to bring this deficit to the attention of the leaders within my company. Research has shown that transformational leadership is most effective when organizational support is given and conveyed to the employees. The third strategy I used was to determine the best means of delivering this training to such a diverse and interprofessional group across the United States. The audience for this training would be social workers, BSNs, licensed clinical social workers, mental health professionals, psychologists, and others who are part of the team. This training had to be flexible as well as structured for the adult learners at different levels of education. I determined that the best solution for meeting this was to utilize a Google blog site that could be accessed 24/7 from any computer that had internet access and to use those adult learning principles. The next strategy I used was to set up post-training evaluation questionnaires and peer reviews that were also flexible and accessible to the staff. These post-training surveys were distributed to be filled out anonymously that allowed the students to reflect on how this training met their outcomes and impacted them personally. This also used 2 guided conference calls for all the groups to allow for brainstorming and discussion of the training, as well as 13 individual program calls to get small group insights and reinforce the training through further to the nurses and social worker case managers. This allowed me, the educator, to gain insights through the observation of the guided discussion as to whether the outcomes were fully met and if the students were actually able to assimilate the information for use in their programs. There were 4 project outcomes identified with this project. To promote awareness, commitment to providing evidence-based professional e-case management practices within the ARNG case management programs, to synthesize civilian case management standards of practice with Army regulations to create standardization of Army National Guard e-case management, to create e-case management training program utilizing adult learning principles that allowed for the adaptation into all of the U.S. states' case management programs, and to promote the understanding of contracting company contractual requirements within the Army National Guard case management programs. These outcomes were deliberately written to be broadly applicable in order to remain relevant as the informational changes came about. We also used live question and answer sessions that were held via small group conference calls and in person. This was on a guided peer review where the students discussed the information specific to the outcomes within the groups. Used a lot of self-reflection as well as peer reflection, which are valuable tools for enhancement of professional development as well as a measurement of outcomes. And these conference calls were designed to allow flexibility within the adult learning principles. Determining if outcomes are achieved is a basic requirement of program evaluation. I had a total of 40 students turn in their post-training questionnaires after the first week of the training, and the feedback was very positive. 38 of the 40 stated each outcome had been achieved and were able to identify with each outcome how that outcome would be pertainable to their state program. The two that said that the outcomes had not been met actually put on their questionnaires that the reason for that was that they did not specifically address their state, yet they were able to, under each outcome, list how it pertained to their state. My mentor felt that all the outcomes had been achieved as well. He stated that the training was very comprehensive as well as delivered in a highly captivating way. In order for evidence to be validated, it must be able to be replicated and verified at different times for the same purpose. The trainings were all viewed in different states on different days at different times, yet the data remained the same throughout. The feedback was very much positive, and I feel that all the outcomes had been met. The significance of this project to the organization is that the soldiers will have a better quality of case management care, better outcomes. Military will have increased IMR percentages as well as lower cost. The company has increased quality of employees and elevated standards of industry, and our staff has the resources they need to develop and practice evidence-based care. All nurses have a responsibility to follow the ANA guidelines within the Code of Ethics and the Standards of Practice, as well as their individual state licensing board regulations and scope of practice. Army National Guard case managers have this responsibility as well as that of following military regulations and policies within their field. This can be very confusing for less experienced nurses. Education needed to be provided to motivate them and empower these nurses in each state to do the research and collect the data to add to the standards in order to meet their fullest potential. This project was about defining standards of practice and helping nurses to understand how to incorporate evidence-based practices as best practices into these standards. The main topics woven throughout the training was the need for nurses and case managers to expand their education, understand their scope of practice for their state, understand the performance work statement, which is the company's scope of practice, their ethical and legal responsibilities, benefits of collaboration and effective communication, and looking beyond what they currently are doing to determine where they can expand their knowledge and training within their scope of practice. This project was the first of its kind within the nation that was specific to Army National Guard case management. There is no standardized training for Army National Guard case managers. The ANA Code of Ethics recommends that all nurses follow evidence-based standards of practice. This project has provided those standards for the nurse case managers and the case management teams that can be utilized not only by my 10 states, but in managers across the U.S. everywhere. And this project has opened the door to educate nurses on how to expand their practices to meet the IOM recommendation of having nurses practice to their fullest potential according to their education and training through the development of further evidence-based practices and by creating and collecting the data that can be used for future research within this field of nursing. In this ARNG case management, culturally and ethical diversity training is a must. The U.S. military is a very diverse population, and our case management teams are as well. This training highlights those standards that include recognizing and applying cultural competency and sensitivity. Its research has shown that the value of nursing practice is decreased when the nursing practice is not based on evidence-based standards of practice. As a nurse leader, it is my responsibility to find solutions to correct this deficit. As a program manager, I need to be able to look at those contracts and those states and those performance work statements and make sure that they are all within the regulatory guidance of that state and the military and that they're being fulfilled. My knowledge and abilities to research topics and data, evaluate programs and outcomes, understand the nursing theory and learning principles were greatly enhanced by this program, and these guided my decisions and actions in all phases of this program. I was not only taught how to do these things, I was actually able to do them within the program, which directly impacted the accessibility and the success and acceptance of this training. Also, this training showed me how to be able to build effective online education programs, and it is one of the best I have ever experienced. It's not only opened my eyes to the responsibilities of a graduate nurse, but has empowered me as a nurse to be able to meet those responsibilities. It's allowed me to look at all the ways my nursing knowledge could be used to fulfill my responsibility as a nurse leader and a graduate level nurse. It's grown my confidence in applying my nursing knowledge and my educator knowledge to fulfill my desire to enhance and empower nurses. And this project has not only built up my credibility within the Army National Guard case management arena, it's given me a platform upon which I can advocate for Army National Guard case managers professionally across the nation. This project is dedicated to assisting the citizen soldiers in the Army National Guard who have not only have to fight the battles around the world and respond to disasters on the homeland, but they also have to navigate dueling healthcare systems that do not always collaborate or communicate in order to recover from physical and mental health conditions. These soldiers deserve the best quality of care available to them, instead of weeks, months, and even years of frustration with trying to get the help they need for recovery. Smart best practices for ARNG e-case management is the first step towards ensuring quality, efficiency, and caring practices are used by the nurses who are assisting them.